Hello everyone. Nice to see you again. Today Health and Healthy Food channel will explore together a very important issue. I know we all live busy lives, and the fact that you've taken time to join this conversation means something. It means you care, and you're willing to listen, to learn, and maybe even to help change something that's become a serious issue in our country, obesity. Now, before we dive into numbers or causes or complicated terms, let me ask you something simple. How often do you notice that almost everything around us is pushing us to eat more, move less, and accept that being unhealthy is normal? Think about it: fast food on every corner, snacks at every checkout, hours spent sitting at desks, and even our kids glued to screens. We're living in a world that practically sets us up to fail when it comes to our health. Here's a fact that might surprise you, or maybe not. As of today, over 42% of adults in the United States are obese. Not just overweight, obese. And that number has nearly doubled since the 1990s. Among children, it's worse than we'd like to admit. Millions of kids are growing up with conditions like prediabetes, fatty liver disease, and high blood pressure, not in their 50s, but before they even finish middle school. But let me be clear. This talk isn't about blame. It's not about shaming anyone or pointing fingers. I'm not here to say, people just need to eat better or they just need more willpower. That kind of thinking oversimplifies a very complex problem. Obesity isn't just about personal choices, it's about the environment we live in, the systems we've built, and the values we promote as a society. We have to ask, why is unhealthy food cheaper and more convenient than nutritious meals? Why do some neighborhoods have gyms and organic groceries, while others have only liquor stores and fast food chains? Why do our school lunches look more like gas station snacks than balanced meals? And why are we, as a nation, getting heavier despite all the diet trends, fitness apps, and gym memberships? These are the kinds of questions we need to talk about. And that's exactly what I want to do with you today. Throughout this presentation, I want us to explore the real causes of the obesity epidemic in the United States, not just what's on our plates, but what's happening behind the scenes. How processed food companies have redesigned what we eat. How work culture and stress affect our bodies. How poverty and inequality play a role. And how government policies, or the lack of them, have shaped an environment where unhealthy has become the default. We're also going to look at how marketing, especially to children, has created lifelong habits that are hard to break. And we'll talk about how certain communities, especially low-income and minority populations, are disproportionately affected, not because they're making worse choices, but because they have fewer good options. But here's the good news. This epidemic is not irreversible. Yes, it's big. Yes, it's complex. But we're not powerless. The first step is understanding, and the second is deciding, together, that we want something better. So, I ask you to join me, not just as an audience, but as a participant. Listen with an open mind. Ask hard questions. Challenge your assumptions. And most importantly, think about how this applies not just to them out there, but to all of us, right here. Because the truth is, obesity isn't just a medical issue, it's a social, economic, and cultural one. And if we want to fix it, we need to look deeper. Let's begin. The scale of the problem, obesity in the United States. Let's continue. Now that we've acknowledged how big this issue feels, let's really take a closer look at just how widespread obesity is in America today. Because if we don't understand the full scale of the problem, we can't truly understand why it matters or how urgently we need to act. Let me ask you this. Have you noticed how it seems like more and more people are struggling with their weight? You're not imagining it. The numbers tell the story clearly, and honestly, it's a story that should alarm all of us. Over 42% of American adults are obese. According to the Centers for Disease Control and Prevention, CDC, as of the latest national survey data, more than 4 in 10 American adults are considered obese. That's over 110 million people. If we include those who are overweight but not yet obese, that number jumps to more than 70% of the adult population. Now pause for a second. 70%. That's not a small group. That's not a fringe issue. This is the norm for most adults in the United States. That means chances are, you or someone very close to you is personally affected by this. And it's not just about how people look. Obesity is linked to a long list of serious health problems: heart disease, diabetes, stroke, certain cancers, joint problems, mental health challenges, and the list goes on. These are not just statistics, they are real lives, real families, real struggles. Children and teenagers are not exempt. Now here's where it gets even more heartbreaking. This isn't just an adult issue anymore. Obesity has become one of the most common chronic diseases among American children and teens. Right now, about 1 in 5 children aged 2 to 19 in the US is obese. Let that sink in: a toddler can be obese. In many schools across the country, we're seeing kids who are being treated for type 2 diabetes, high cholesterol, and even early signs of heart disease. These are conditions that used to be almost unheard of in children just a few decades ago. Today, they're becoming normal. And let's not forget the emotional toll. Kids who are overweight or obese often face bullying, shame, social isolation, and mental health struggles. They carry those scars with them into adulthood. We're not just talking about bigger bodies, we're talking about shorter lifespans, lower quality of life, and a lifetime of preventable illness. Disparities across communities. But this epidemic isn't affecting everyone equally. That's another part of the story we need to talk about honestly. If you look at the data more closely, you'll see clear racial, ethnic, and economic disparities. For example, the obesity rate among non-Hispanic Black adults is over 49%. Among Hispanic adults, it's around 45%. Among non-Hispanic white adults, it's about 41%. Among Asian adults, it's significantly lower, around 17%, but rising. And if you look at income levels, another pattern appears: people with lower incomes and less education are more likely to be obese. But let's be careful with how we interpret that. This is not about people being lazy or unmotivated. Often, it's about living in neighborhoods with no access to fresh food, working multiple jobs, having no time or space to cook, or facing generational cycles of poor nutrition that they were born into. In other words, some people have to fight much harder than others just to have a fair shot at being healthy. Geographic differences: where you live matters. And yes, where you live also affects your risk. If you travel across the country, you'll notice big differences in obesity rates from one state or region to another. For example, states in the South and Midwest tend to have the highest obesity rates. Think Mississippi, West Virginia, Alabama, and Oklahoma. States in the West and Northeast, like Colorado, California, and Massachusetts, tend to have lower rates, though the numbers are still rising everywhere. Why the difference? It's not just about personal habits. It's about access, education, community infrastructure, and policy. Some states invest more in public health, recreation spaces, bike lanes, school nutrition programs, and community education. Others do less. So the truth is, your zip code may influence your health more than your genetic code. Obesity isn't just rising, it's accelerating. What's even more alarming is how fast the numbers are going up. If we look back just a few decades, say to the 1970s and early 1980s, the obesity rate in the US was around 13%. That's less than 1/3 of what it is today. So in less than 50 years, we've gone from 1 in 10 to nearly 1 in 2. That kind of growth doesn't happen by accident. It happens because something fundamental has changed in how we live, how we eat, how we work, and how our society functions. It's not that Americans suddenly lost all self-control. It's that the environment around us changed faster than our bodies could adapt. Our biology is still wired for survival in a world of scarcity, but we're now living in a world of constant abundance, engineered convenience, and addictive food systems. What does this mean for the future? If this trend continues, and right now, it shows no signs of slowing, we're facing a public health crisis unlike anything we've seen before. Millions more will develop preventable chronic diseases. Healthcare systems will be stretched to the breaking point. National productivity will decline. And our children, yes, our children may be the first generation to live shorter lives than their parents. That's where we are. But here's the thing: acknowledging the problem isn't the same as fixing it. And that's why we can't stop here. We've now seen the numbers. We understand the scale. We know who's being affected and how it's spreading. The next step, the most important step, is understanding why. Because if we can uncover the real causes behind this epidemic, then maybe, just maybe, we can start changing the story. Let's talk about those causes, starting with one of the most obvious and powerful forces in our daily lives, the food we eat. Second important point: dietary factors leading to obesity. Alright, let's keep going. We've just talked about how big the obesity problem is in the United States. The numbers are overwhelming, yes, but now we need to ask the next logical question. Why is this happening? And while there are many causes, and we'll get to several of them, let's start with the most obvious one. What we eat. Now I know this sounds simple. Eat too much, gain weight. Eat less, lose weight. That's what we've been told for years. But here's the truth, it's not that simple anymore. Because the food we eat today is not the same as the food our grandparents ate. It's more processed, more sugary, more fatty, more addictive, and more available than ever before in human history. Let's talk about that. We eat today is not the same as the food our grandparents ate. It's more processed, more sugary, more fatty, more addictive, and more available than ever before in human history. Let's talk about that. 1. The rise of ultra-processed foods. In modern America, we are absolutely surrounded, by what nutrition experts call ultra-processed foods. What are those? They're foods that have been heavily altered from their original form, often stripped of their nutrients and packed with added sugar, salt, unhealthy fats, artificial ingredients, and preservatives. Think packaged snacks, sugary cereals, instant noodles, frozen dinners, soda, candy, fast food burgers, microwavable everything. These foods are everywhere. They're cheap. They're convenient. They're marketed with bright colors and fun characters. And this is key, they're designed to be irresistible. I'm not joking. Food scientists actually engineer flavors and textures to hit what's called the bliss point, that perfect combination of sugar, salt, and fat that makes your brain say, I want more. Now let me ask you something real. When was the last time you craved steamed broccoli? Compare that to how often you've craved chips, fries, pizza, or cookies. See the problem? 2. Sugar is everywhere. Let's talk about sugar. Because this is a big one. In the 1800s, the average American consumed about 2 pounds of sugar per year. Today, we consume over 100 pounds per year. And we're not even aware of it. Sugar is hiding in everything. Ketchup, bread, pasta sauce, yogurt, salad dressing, healthy granola bars. And of course, the biggest culprit of all, sugary drinks. Soda, energy drinks, sweet teas, frappuccinos, they don't just add calories. They're calories with no fiber, no protein, no nutrients. Just pure sugar rush. Drinking just 1 can of soda a day can lead to 15 extra pounds of fat per year. And many Americans drink way more than that. Sugary drinks are strongly linked to type 2 diabetes, fatty liver, heart disease, and, yes, obesity. Yet, we still see them advertised on TV, in movie theaters, in vending machines at schools, even at hospitals. 3. Portion sizes have exploded. Here's something else that's changed over time: how much we eat. Go to a fast food restaurant today and look at a medium soda. It's about 32 ounces. That used to be considered extra large in the 1970s. A burger that once weighed 4 ounces is now 12. Fries are triple the size they were 40 years ago. Even plates at restaurants and in our homes have gotten larger. So what do? We fill them. Because we've been taught to finish what's on our plate. All of this leads to what we call portion distortion. We don't even realize how much we're eating anymore because we've lost track of what a normal serving looks like. 4. Fast food culture. Let's be honest, fast food is a way of life in America. It's cheap. It's fast. It's open late. It's on every highway. And for many people, it's one of the few options they have. But fast food is a major driver of obesity. Why? Because these meals are calorie bombs. A typical fast food meal can easily hit 1,200 to 1,500 calories, which is almost your whole day's worth in one sitting. And it's not just the calories. It's the lack of nutrients. These meals are often low in fiber, vitamins, and protein, and high in sodium, saturated fats, and sugar. And here's the thing, they don't make you feel full for long. You get hungry again quickly. So you eat more. And the cycle continues. 5. Marketing to kids and adults. You know who else is being targeted? Children. Fast food companies and snack brands spend billions of dollars every year marketing directly to children. On TV. On YouTube. On mobile games. Even in schools. Kids grow up seeing thousands of food ads every year, most of them for junk. And that shapes their habits for life. Let me say it plainly. We are training our children to become addicted to unhealthy food. And adults aren't immune either. Just look at how food is advertised. Treat yourself. You deserve it. Comfort food. Snack happy. We're constantly being told that eating is about pleasure, escape, convenience, not health. 6. Food deserts and lack of access. Now some of you might be thinking, why don't people just cook at home or eat healthier? And to that, I say, it's not always that easy. In many low-income communities, especially in inner cities and rural areas, people live in what we call food deserts, places where it's hard or even impossible to find fresh fruits, vegetables, or whole grains. You might have a dozen fast food joints within walking distance, but no grocery store for miles. Or the groceries that are available are more expensive and lower in quality. When your only choices are cheap, processed, shelf-stable foods, it's incredibly hard to eat well even if you want to. 7. Time poverty and convenience eating. And then there's another factor, time. We live in a fast-paced world. Many people work long hours, sometimes 2 or 3 jobs. They're commuting, raising kids, barely getting enough sleep. So what happens? They reach for what's fast. What's convenient. What's prepackaged. Cooking healthy meals takes time, energy, money, and planning, luxuries many people don't have. So convenience wins. And the body pays the price. So what does all this mean? It means that the obesity crisis in America isn't just about people eating too much. It's about what kind of food is available, affordable, marketed, and normalized. Our food system has shifted drastically in the last 50 years, and our bodies haven't caught up. We're up against a culture of fast and processed food, a flood of sugar and hidden calories, a lack of access to fresh, nutritious options, constant messaging that tells us to indulge. And all of it adds up. Obesity isn't the failure of individual willpower, it's the result of a broken food environment. But knowing that gives us power. Because if we can understand how the system works, we can begin to change it. Because even beyond food, there are still factors that strongly affect our body's culture, weather, lifestyle, society, genetics, and even the living environment, and they are all important. We cannot change them, so we need to change ourselves with our daily foods, diet, and exercise regimen. They will help us gradually avoid the disease called obesity. Thank you for listening. I wish you all great health. Sincere thanks. We believe that food is the first medicine. A healthy diet not only helps you feel better every day but also lays the foundation for a happy and sustainable life. Hit the subscribe button and turn on the notification bell so you never miss the latest videos from Healthy Food and Health. Don't hesitate to leave a comment and share your experiences with our health-loving community. Healthy Food and Health, eat well, live well every day.